I wanted to spend a moment talking about new therapies in breast cancer, but they're really based on much older therapies from breast cancer. In this issue of Cure magazine, we have quite a bit of information about treating breast cancer based on estrogen blockade and other approaches that block one of the key features that make breast cancer and certain other cancers run, and that is stimulation by hormones. So blocking estrogen has actually been a fairly old treatment dating back to 1896 when it was first shown that removing the ovaries could actually have an impact on certain cases of breast cancer. Now, over the decades, we've learned quite a bit about how estrogen fuels breast cancer growth and have been able to block it mostly at the level of the estrogen receptor, which is a key protein that mediates the effects of estrogen. However, as we start to understand more about this pathway, we're starting to learn something that's very general about cancer, and that is that many of these growth pathways that are abnormal in cancer are actually part of vast networks, sort of an interstate system that has many bypass routes, so that when you block one road, the cancer may find another route to grow. And this is certainly the case with hormone receptor pathways, such as those that the estrogen receptor governs. There are many so-called bypass pathways. In fact, some of these involve pathways that we have discovered since that time. For example, the HER2 receptor, which is the receptor that's blocked with the drug Herceptin. Those two pathways actually interact. So just this year, a new drug was approved that blocks part of the growth factor receptor pathway called mTOR. The mTOR inhibitor, everolimus, also known as Afinitor, was approved in combination with a hormonal therapy called aromatase or exemestane. I believe that this is really the tip of the iceberg. We are going to start seeing more and more of what is called combinatorial therapy, and that is treatments that are designed to block multiple pathways. And if you think about a river flowing downstream, many times branches and tributaries form to bypass the main river. So if you're going to block it with a stone or a dam or anything, you must find out how the water is going to run around other areas. And if you can successfully block it at many points, you're going to have the effect that you want. This is exactly what we're going to find in cancer biology. So as time goes on, you will definitely see more approaches where we are using two or three or maybe a cocktail of drugs, so to speak. Very similar to the way HIV disease has been treated with a cocktail of drugs that blocks the viruses at numerous mechanistic points. We're going to see more of that in cancer, and little by little we expect that outcomes will improve. We're all looking for that big, dramatic, one fell swoop treats all of cancer. I don't think we'll see that, although we may see some big steps as well as small steps along the way. But certainly the good news is we will see more steps with combinatorial therapy. So that is one theme that I wanted to point out. You can read much more about it in the upcoming issue, and as always, we welcome your comments. Thanks.